Yeah, a little bit, yeah.
Okay.
It's good. Thank you so much for speaking to Family First. So this is a new concept for me that people would be relying on Medicaid, the state-run needs-based medical assistance for their medical needs instead of relying on their own savings. Can you tell me a little bit about this?
Well, that's right. It's called Medicaid planning, Mary Jo, and what it is, it's the strategy of giving your assets away in order for you to qualify for, in this case, Medicaid or the government programs. And we were so surprised with the recent survey that Nationwide Financial did with over 500 financial advisors that over half of them said that they have had clients that have inquired about this as a long-term planning strategy to take care of themselves in nursing home and for long-term care and to qualify for Medicaid. And first we thought that was an alarmingly high number because Medicaid is a program that's in place for those that really need it. We're talking about people that don't necessarily need that assistance. Through other surveys, advisors have told us that maintaining control in retirement is one of the most important things for individuals. And you actually, if you give your money away that way to qualify for Medicaid, you end up giving away a lot of control, and we can talk about that in a moment.
I would think that you also are really relying on the feasibility of the Medicaid programs in each state, and we've got lots of states that are really in a lot of financial trouble, so that doesn't seem like it's a great plan.
Well, that's right. Medicaid is governed state to state, although it is a federal program. So you have this combination of decisions that are made at a federal level, but then also each state has different laws that govern the Medicaid program. The thing that creates some urgency in this is in 2014, there'll be more Americans that are eligible for Medicaid. So again, today, some of the loss of control may be that you can't go into the nursing care facility that you want. You may not be able, depending on the state that you're in, to be able to leverage and utilize home health care, visiting nurses. Medicaid is really about assisted living, being in the nursing care facility. And you don't have a private room. So these are things that as you think of the Medicaid program today, more people coming into the program, what will it look like in the future? You really, again, for your audience, want to understand what loss of control you may have. And we've provided a tool for financial advisors that can go on and estimate their clients' long-term care expenses. Because with people so terrified of those long-term costs, we think a good place to start is to estimate what your individual expense might be. And on nationwide.com/healthcare, your listeners can go in and start that assessment process.
And so that's where they can kind of decide if they're willing to give up their control in order to sort of save this money versus keeping the money with themselves and being able to control what their care is going to look like.
Yeah, the assessment allows you to just establish what are my out-of-pocket expenses going to be, both for health care and you also can have it for long-term care. Then we recommend that you talk to your financial advisor around strategies that are right for you. And we would also recommend that if Medicaid planning is part of your plan, that you involve an elder care attorney in your state, because state laws are different, and it's something that if you're trying to leverage a program that wasn't intended for those of us that have assets, you should be very, very careful with that. And there are other solutions that are out there as well. Long-term care policies, life insurance that helps you pay for long-term care, etc. So again, these are things that when people are terrified, they kind of freeze and they do nothing. We want to get this dialogue with your listeners and your audience and their financial advisors, and we're doing a lot to help educate financial advisors at Nationwide Financial to have these conversations.
Fantastic, John. Those are great solutions. Thank you so much. And it's something that I don't think a lot of people know about, so I'm glad that we can bring it to the front a little bit.
Great. Thanks for having me.
Absolutely.